Welcome to Ra Online. Today's topic is maternal infection and preterm labor. Now this talk is confined to infections and spontaneous preterm labor. This preterm labor will not include other causes of preterm labor other than infection. We will not include induced preterm labor, and we also will not include the routine management of preterm labor. The flow of this talk is definition and prevalence of preterm labor, causes of preterm labor, pathophysiology of infections and preterm labor, the diagnosis of preterm labor, the role of antibiotic therapy in infection-induced preterm labor, and what are the confusions and conflicts pertaining to these topics. Now coming to the gestational age and terminology of preterm labor, which is adopted by the Maternal and Fetal Foundation. So a term baby is 37 to 42 weeks of gestation, 259 to 293 days. Early term baby is 37 to 39 weeks, and a full term baby is 49 to 42 weeks, and a late term baby is 41 to 42 weeks. A post term baby is the one which is born after 294 days or after 42 weeks. A preterm baby is the one which is born less than 37 weeks. Late preterm baby is the one which is born from 32 to 37 weeks. A very preterm baby is the one between 28 to 32 weeks, and an extremely preterm baby is the one which is born at less than 28 weeks. Now, definition of premature labor by WHO includes uterus should be contracting, 4 contractions in 20 minutes or 8 contractions in 60 minutes. Cervix must be having a dilatation of more than 3 centimeters and effacement of more than 80%. And cervical length should be less than 2.5 centimeters to call it as premature labor. The gestational age of the woman should be between 20 to 24 weeks to 37 weeks, and this is when we call a lady to be having a premature labor. Now, what is the prevalence? The preterm labor globally, 5 to 18% is the prevalence of preterm labor. Preterm labor is 9% in developed countries, which is much lesser than developing countries, which is 12%. In India, it lies 10.86, which is between developed and developing countries. Now, in the late preterm labor, the incidence is 72%. So that is good news. So most of our preterms are not early preterms, they are late preterms, okay. So 72% of the children are late preterms, and the late preterms are the one between 34 to 37 weeks. Very preterm babies is a rare incidence, and it is 2 to 5 among 1000 pregnancies. And these very preterm babies are a major challenge to the healthcare system. 15 million babies are born preterm every year, and 1 million death happens by 5 years. So preterm baby is a important cause of under 5 death rate. Now coming to the number of live births in different gestational age. So as we see that with the years coming, we have had the percentage of live births at preterm has been increasing. So from 1990 to 2008, we see that less than 32 weeks, the incidence is 1.79 to 1.73%. So it is almost around the same. For the children born between 32 to 34 weeks, also from 1.23 to 1.26, it is also around the same. And the late preterms, which are 6.69 in 1990 to 7.75 in the 2008. So the children, the late preterm incidence has increased over the period of 8 years. Reproductive health medicine tells us that the preterm birth complications happen around 1.08 million, and this preterm birth is a direct cause of 35% of all neonatal deaths. Other neonatal conditions also cause newborn deaths. Congenital anomalies cause newborn deaths. Neonatal infections cause newborn deaths. With the indirect cause, moderate and late preterm birth increases the chance of dying from infections, and intrapartum related deaths are also seen in the preterm babies. So preterm baby is a risk factor for neonatal and post-neonatal death. At least 50% of all neonatal deaths are preterm babies. So prematurity is a very important cause of neonatal deaths, either directly or indirectly. What is the impact of preterm on fetus, neonate and adult life? Is it a cause for concern? Now we have something called as the fetal programming. So when a normal fetal development is disrupted by an abnormal in utero insult, it leads to triggering of some mediators, cytokines and inflammatory markers, which lead to the effect on fetal organs and their function. Now the fetal organs undergo adaptive changes in structure and function. So this is called as fetal programming under the influence of insult. And this fetal programming is caused by a change in uteroenteral environment due to maternal diseases, infection, inflammation, hypoxic and ischemic events during the intrauterine life. Now this leads to low birth weight and neonatal death, underdeveloped organs, neurodevelopmental and body function defects. It can lead to cerebral palsy, motor and sensory disabilities, cardiorespiratory problems in adult life, early brain aging. It can also lead to increased risk of congenital diseases and cardiac diseases. Now, is preterm labor on the rise? Yes. So, the March of Dimes 2020 report card showed that the US preterm birth hits 15-year high rates increase for women of all races. The preterm birth rose 4% 2021 from 10.1% in 2022 and 10.5% in 2021. So, preterm birth is on a rise. Now, there is a World Prematurity Day which is celebrated on November 17 to address this cause of neonatal morbidity and take measures against it and to increase the social awareness. In India, the preterm incidence is rising and it is around 21%.